Hello everyone, I'm Chris Leong. So today, very happy and wow, so fast. The COVID since the last year uh, in Malaysia, the COVID start at March 18 and to 2020. Now it's 2021. March, May already is already 1 year and 2 months. And a lot of people say, what is this COVID-19 and what? Actually, we have to responsible. Actually, we have to responsible what? Because I see Malaysia maybe will be locked down or maybe because why we call it a movement control. The government have to take charge because why? I can say actually you can see it's like up and down and down. And this COVID-19 since the last year until now, and then lockdown, and a lot of people cannot work and work from home, and then the lives are all changing. And what I'm saying from my experience for this COVID-19 is a virus, it's not a bacteria. And a lot of people don't understand about, really don't understand what is the meaning called the virus or COVID-19. And I taking this opportunity, it's not about right or wrong, and then it's not about how true is my information from my experience and see from one whole year. And this COVID-19, we are the what I call we are the citizen of the country. Citizen of the country, we have the responsible to make sure that this number have to go down. And so happy that yesterday in what I call, I saw a book from my kids. Kiki Lala is about 9 years old, and then they bought a book what is a virus. And then even the small kids, like my twins, 9 years old, he explained to me, Daddy, you know what's the virus? From there, I really understand. So for this today, this live, just want to share with you guys sharing because why? I think it's responsible to everyone know how powerful about this COVID-19, and we are the part of the what I call citizen in the country. Yet we have a responsible to take care of our own responsibility, have to take care of your own health. And a lot of people asking me, hey Chris, how should I this? Actually, what is the difference about COVID, bacteria, and a virus? So after I see this book, then I know actually the bacteria and the virus. Bacteria is more bigger than the virus. Where the virus is very tiny and very small. So I say, then Daddy, you know how tiny about the virus? Bacteria is a big size, and the virus is very very small only. And then you see, Daddy, you know, like 50,000 virus in the needle head. Whatever you see, the needle head only, the needle head. They are inside the needle head only. They have a 50 million of the virus is attached to the needle head. So I said, wow, a lot. So that's why when you put in the microscope, you see it's about more than 15 billion virus in a small dot. So that's why, wow, I say, wow, so impressive. Even my kids, Kiki Lala, 9 years old, he explained to me. And after that, we go through about this book. So, and then I know, see the India, now the India, we are so sad. And then they are, because of now the mutation of the virus of the COVID-19 and a super killer. And this last 1 week, I see the news, I'm so sad. Even they have become a convert to car park, from car park and burning all the people die because of COVID-19. And every 4 minutes they are burned and then lost life, and then see a lot of what I call the sadness from the family members, cannot do anything, just not barrel, it's just to burn, to arch. So it's real sad. So I don't want this happen to every country or what. So we have to responsible to how to get this number go down. Go down means in the sense of what I call, we have to responsible to fight, let this COVID number go down. And I got a few friends now. I can see everyone got everywhere is a COVID. Even last one whole year, 15 months, I didn't see any relative or friends got COVID symptom or what. But now I can hear from my friend here, go here. Even I say, hey Chris, you go to Indonesia, you're a high risk person. You're so high risk person, you also not gonna the COVID. And then me, I didn't go anywhere, just karaoke with the friends only. I also locked down in the house for a while, also got COVID. So this COVID, did not see whether your age, your work, your job, your sex, or how healthy are you is a responsible. Actually, the COVID is a transmit by the airborne. So he will enter to your mouth, nose, and your eyes. A lot of people thought it's about you have to wear the mask. It's enter from nose and mouth. And of course, a lot of people don't understand they also enter from the eyes. So these are three areas is very important. And also one very important, you just notice, like our hand, whatever our hand moving, every 3 to 5 minutes, you automatically will touch here, touch there, touch your whole body one, especially your face. That's why a lot of people don't notice about every 5 minutes you got to touch on your mouth or nose or your what. So this is a bad habit. So is what I call very normal, like touching here or here. Always like to touch. That's why before you touch, you make sure your hand have to always sanitize with a with a alcohol or what, or wash your hand. So if you don't simply touch things like open the door, you don't using your palm, using your backhand or what, or using your elbow to open the door or touch the lip. Don't even touch. Whatever you touch, you touch other part. Is about 50, one dot of a virus is about 50 million of what it will spread very fast. That's why now I know the virus. That's why you can see the COVID-19 they have a spike. Quite a number of the virus they have a spike one. So it's exactly like this. So this is a quite good book. Actually, because I'm not a study person, so my kids give me this book. It's about picture form. Easy to understand. So I see, understand. So that's why you can see from here, they have so many kind of virus. 3, 6, 9, 10. About 10 virus is very common. But this virus cannot kill, cannot take like a bacteria, take an antibiotic. After eat an antibiotic, then you can kill your bacteria. But the virus can't. Like example, HIV is a part of the virus. So this HIV virus cannot kill also. It's only in your body and subside and compress the virus. Then like hepatitis B, a lot of people got hepatitis. That's why they're inside your body have to inject a hepatitis inside to not activate, not active. And even polar virus and COVID-19, like yellow fever, like the kids that come up already got a yellow fever, also a part of virus. The more daily one is Ebola. Ebola in Africa until now, how many years already? I think, I don't know. I don't know how long already this Ebola, but still very deadly virus in the world. That master with Chinese, we call it like sangse, that catching the snake, the virus. Then they are using the traditional, they are using the joystick and catch the snake. And through chickenpox also a virus. That's why the virus is very difficult to kill. It's only not like taking antibiotic for the bacteria, but virus you can't do that. So usually virus is in your body already, but it's only how to suppress. That's why what I call the vaccine. A lot of people thought putting the vaccine already no problem. No, the vaccine is to subside and not active the things, but in your body you know how to handle with it only. And quite good about this. And then one thing, I wash hand. Some people like washing here like this. Actually, wash hand in this book it will teach you like wash hand is about 20 seconds. But like me, I don't know wash 20 seconds for how long. How you count? Of course, I got eye wash. It will tell you 20 seconds on the wash hand. But for this book, it will teach you quite good. Quite good is a wash hand. The time you singing one song, singing the Happy birthday to me, happy birthday to me. Happy birthday to me, happy birthday to me. Actually, this song is taking about 20 to 21 seconds. So I tried it before with the watch and everything. I'm singing the happy birthday to me, happy birthday to me, happy birthday to me, happy birthday to me. After that, wash your hand. I see my watch really 10 seconds. So this is one of the best. If you didn't wash or what, you wash hand, you just singing about 20 seconds. Actually, it will break. Because the virus got the spike. This spike will attach easy to attach all the parts. So that's why you're on the body. Then that's why you have to wash hand or using alcohol or soap. He will easy to get off the virus and wash away. And also you have to always don't simply touch things. like last time last time I go for in US I training for firefighter that time. So firefighter, every time you open the door, because sometimes the door is very hot, you cannot using even you're using a glove or what, you cannot use your palm and open, because why? Sometimes it's burning your hand. After you burning your hand, you cannot hold things, you cannot hold a hose or anything, or even you cannot. That's why he always ask us to check before open the door, see the temperature of the door. Always open the glove using the back and touch. So the back and touch, why? If anything happen to your skin at the back, but we are not using too much or not using back to rub our face or what, the most important is the front portion. If the front portion don't touch on your face on it, it's very difficult for your elbow or what to touch. That's why if you go for the lift, don't holding the handles, don't holding the handlebars or anything, or pressing the lift. If possible, using the key card or key, just press on it, using a fingernail to touch, or using your what, don't, you have to change your lifestyle. You're using more, don't use on the palm. All right. And always a lot of people say, how about using mask is good or not? Actually, using mask is one thing, is what I call transmit the airborne. One thing, of course, the virus is very small molecule, difficult, but at least filter not enter your mouth that easy and your nose. Of course, a lot of people now time you can see wearing a big sunglass or any glass is good, not easy to attach to your eyes, because the virus enter to your bodies from eyes, nose or mouth, these 3 points. And always wash hand, keep a distance and what. And so hope you all guys everything, if you have nothing to do, stay at home, don't go out everywhere or make fun of it. And I just received what I call the message just now about 10 minutes ago. So I read out from Dr. Zaleha Muhammad Amin. So he said about the COVID information, due to the collapse of the health system, the symptom appear of the 3rd day of the infection. Let's say whatever you got a symptom of the virus, because this COVID-19, it take about 2 weeks to detect. It's not like other symptom, you got fever, tomorrow you can detect. But usually symptom that appear for the 3rd day infection, the virus symptom. So whether this symptom is a body pain, eyes pain, headache, vomit, diarrhea, running nose, decompression, burning eyes, and also when you urine the time you feel burning, feeling uncomfortable, sore throat. So usually you got this symptom on the day 1 or day 2 or day 3. Actually this day 1, day 2, day 3 is a symptom for the COVID, but before that you already about 5 or 6 days, you already inside your body got a virus. So it's the activation in your body is about 3 days later. You got this symptom, means you have to quarantine yourself. You have to go for what I call, you have to see doctor. And then whether you are quarantined at home or, but before that, you got this symptom, you have faster, have to drink a lot of water and see doctor. If not, it become like a high fever or terrible fever, then your body will attack so many part of your body. So after that, usually for the day, you already see so many people. Like me, I go there and see, or staff or what, you already transmit to so many people. So this virus in your body, he will produce and duplicate so many virus and spread, and from airborne, even like sneeze, your mouth, your sneeze, your cough, all this one will transmit. It's airborne, so you very stick to, you spread to other people's. And after the day 1, day 2, day 3, you got like eye burning sensation, whatever you feel, body aching, and then compression little bit, and diarrhea, even like urine or what. This is a 3 day symptom. If you not take care very well, day after the 4th day, the second phase, we call it the 4th day to 8 days, we call it inflammation on your body already. So this COVID-19, the virus will attack you. Loss of taste. If you loss of taste, you thought it's a COVID on the first day. No. If you got loss of taste, you already 1 week already. 1 week you got this symptom, then you can loss of taste and smell. And always a chest pain, rib cage, whatever your rib cage, feel like the compression very hard and very painful on the rib cage. And the taste, you feel like whatever you drink water, you feel like a shit water. You smell also no smell. Whatever taste on your mouth, all gone already. And tighten on the chest. You feel this part very compression, difficult for your heart to pump. So this is called the second phase of the virus. and always lower back pain, always lower pain, sore pain. So this virus will attack the ending the difference between the fatigues. So if you see this one, you always have to faster have to see doctor, because why? You are dehydrate your own self. This if you got this symptom, yeah, whatever, if you fever, you have to go and see doctor, or taking some medicine. You have to suppress. If not, the virus in your body, it will eat up everything. You are very hydrate your own body and life threatening. So you have to drink a lot water. You have to take a lot vitamin C, and you have to take a lot of what I call oxygen. And during this really, a lot of people, especially from India, text me, Master Chris, can you teach us how to breathing? Can you teach us how to breathe? Because in India, they have no oxygen, not enough oxygen container for them to supply. So a lot of people, that's why in this COVID, the first thing that attack is your chest and your breathing, respiration part. So of course the breathing is very important. So usually you're asking like a fish, what is fish, are you fish, what is the water? The fish will scold you. Oh, this fellow don't know what is the water. In this world, where got the water? Because why? The fish every day inside the water. They don't know what is the water, because why? They are floating, buoyancy control, everything inside the water. So that's why you're asking the fish also don't know what's the water. Same like a human. You're asking what is the oxygen, because every day we are taking advantage of the surrounded. Everywhere is oxygen. So you're asking people what is oxygen. A lot of people don't know what is the oxygen. So the breathing is the king from our whole body. That's why you can practice this one. We call it the 328. 328 is very good for your respiration and your lung expansion and discharge or what. A lot of people got like cancer patient or what. Their breathing is very important to cure so many things. Like for my formula, the breathing part is I teach to my Indian friends asking how to breathing. So whatever I know I teach. We call it a 327. 327 is a 3, 2, and 7. 3 is an inhale. 2 is a stay. And the 7 is an exhale. And inhale. Stay 2 seconds. And exhale for 7 seconds. So this is actually one of the very good breathing for your lung and your whole body. You know, some people is very tired. Wow, a few days didn't do anything. Wow, so tired. Overwork or what? Then I go back home like this. Yeah, so tired. Actually, this is one of the breathing, and all the oxygen to your hand, finger to your thumb. After you lie on the bed, then you sleep already. So this is one of the part of the breathing system. We call it 327. That's why a lot of people say, hey, Chris Leong, you sleep so late. Actually, I sleep about 3 to 4 hours a day only. I sleep about 4, 5 o'clock in the morning, wake up at 7 or 8 o'clock. So, wow, your complexion so good, even you're very energetic. It's due to what? It's due to do this exercise breathing. We call it more oxygen to your body. Some people sleep about more than 10 hours to 10 hours, 20 hours are also no use, because why? They didn't have a quality sleep. Alright. So if you can buy this, what is the virus? So I go through. So virus, they have a spike, easy for them to stick. That's why you see all the viruses usually got spike one. So easy to stick. So this one my kid teach me. So I explain to you. Even they have a 500 millions of the fit on the head of the pin. So they're using the head or hair what. They have a 500, not 50 millions, 500 million virus stick on it. And also usually virus in your human body, they have 200. They have around 200 human virus. So our body, they have a 200 over in the body, and then more than thousands from the animals. So for a lot of people say from here, where does the virus come from? So this virus come from some from a harmful one, spread the human from other animals, from the bed and from the pig also. So actually, my kids teach me better. Daddy, you know this COVID is from the bed. Actually, the bed, they carry the virus, like your human also the virus in the body. It's rather how you transmit. if you combination on the body, very difficult one. After combine, there become a new things, they call it virus, and then spread very fast, and duplication very fast. Even like computer also got virus, same thing. So computer, whatever download, you open and enter your computer, and whatever you type and send, you go to your directory or what send. The virus is called spread very fast one. So we are the citizen of your country, you have to be responsible. Virus is very powerful, we have to handle with care and take it very seriously. If not, the number will going down, because now it's not affected only one country or Malaysia, it's all around the world. You can see like India is very sad, and it's very sad. That's why you don't simply touch. Even if someone is fall down on the bed, you want to help, you have to use a SOP. You cannot simply and then touch and then hug. If you touch and hug, then you can transmit so many people. So not all virus is bad. Some human virus. Virus in our body is good to protect our organs or what. So hope you all guys understand more about virus. So that's why how the insects spread the virus, like a ladybird or what, they are not spread. The mosquito can spread the virus. We call it like dengue. And wash the hand, good sterilizer, injection. And usually a lot of people please asking me, because sometimes I see so many people and they have so many times the PCR test or this one test or mouth or nose test. And one of the best thing for me, I like to test using the like a pregnant test. We call it a rapid test. So I also want to test, because see whether my body got virus on it. This look like a pregnant tester. Same thing, I do it again like this. You can see, this is a COVID test, and then this got a line like pregnant. You put your own blood and also the solution. After that, about less than 1 minute, you know whether you are in healthy or not. So because I have to take care for my family, my kids, got old people, got kids, got children at home, so I have to responsible myself. Before I go back, I have to check. So easy, sterilize a hand. Put here. Usually I'm using a fork finger because I'm not touching so much thing here. This is a one-time usage pin. Then put over here. Wow, see? Then you can see the blood. See, you can see the blood come out. Then what you do, I just put on top here. So you can see my blood touching, and less than 1 minute using solutions. Put 2 dots. Put 2 dots, and you can see the water line is going up. So this one, before I go home, I always test to make sure my body condition. So this is called rapid test kit. And one thing is good about this one, this is not COVID test exactly. It's testing the virus in your body. If let's say you test you got 2 lines, whatever you can see 2 lines, then your body got not exactly got a COVID. Maybe you got see 2 lines means your body got a virus, maybe dengue virus or what virus. So every time before I go home, I have to make sure test. That's why I used to do all this. There are only few things: one tester, solution, and the pin. So after that, you can see. You can see my one only got 1 line on top, not 2 lines. If got 2 lines, means my body got virus. Maybe it's a COVID or the any type of virus or dengue or virus. If you see this one, so I'm safe. So my body inside right now, before activation, I'm in good condition. So this is one of the easy solution to make sure you are whether carry any symptom of virus. So that's all. So I feel safe. Always, if you feel safe, you always have to wear your mask too, and also wear your glass. Okay, always remember, the virus enter from your eyes, nose, and your mouth. Good. And I hope you all guys and also don't see, I also touch within 10 minutes. I already touch my face or eyes or what, more than about 2 or 3 times. Tell you, this is our very automatic. Our hand automatically will touch on your face portion is about 2 to 5 minutes. Always before you touch or touch on the spoon or what anything, always have to using a sterilizer to clean up first. Like me, I always have. Always have a sterilizer with me. So this one easy for me because why? Like a credit card size, I can put everywhere in my pocket. What? Just spray and spray and rub. This is one of the very good solution. Whatever you simply touch, you have to make sure. Hope everyone. This is a handphone is the first priority. Everyone need it. Then the second one you need a sterilizer. Third one you need a mask. And also fourth one, if you got a sunglass or what, you have to wear glass. If you like this, you can reduce so many of the transmission of this COVID. And nothing, don't go out. Don't simply go out with a big group. Like example, like karaoke and bar or what, because why? Their air ventilation not that good, very easy to transmit to everyone. And like karaoke, the mic, all the 10 people, they are sharing one mic, because one mic, they are always have airborne so much, and your nose in and out, very fast to transmit. Usually quite a number in the karaoke is transmits quite fast. And whatever you want to karaoke, yes, you will possible wear mask and singing. Okay, or wear mask or singing, every time you have to stand inside on the mic. And this is one of the best solution. And stay healthy, always carry with you sterilizer, mask, and always if you want to touch everything, like open the door, touch the lift, everything, try to use your elbow or back of your hand or your fingernails or keycap or key. Don't try to minimize to touch everything that you can. Alright, and my Chris Leong, I'm very happy. Now it's already 1 month plus already. This COVID makes so many people worry, and a lot of people didn't take up this what I call the COVID seriously. Thought, oh, like this. So this COVID actually is cannot difficult to cure. It's only got a vaccine to with your body. So with your body, like a lot of people asking, hey, this COVID, this one after quarantine 10 days already, and then he can see people, but actually is in your body, he's died off, not 100% die, and not so active. It's like a hibernate. So hibernate, that one is in your body is good. Sometimes it's protect your what become actually this the virus in your body is depends on to either die or activate. Actually, we don't want the virus die or to activate. If activate, it can produce so many. We want to suppress and suppress, and no matter what. So thank you for government what I call their complement so many the vaccine dose for us. And a lot of people worry about, oh, the China one, or US or Pfizer or what. So many type of a vaccine, which one is good for what? It's very difficult to say, because why? Example, we taking the Panadol or paracetamol. Panadol is very common. Everyone got headache. This is a very mild medicine like Panadol. Not everyone people can take the Panadol. It's the same. If 100 people, sure, 1 or 2 people taking the very common, we call it a Panadol. Also, people got the eye inflammation or eye sensitive, and also difficult breathing. This is a part of the what I call the symptom. You know, the vaccine for the COVID is not like Panadol. It's a very powerful medicine. Some people like low blood, high blood, or old people, they cannot take it. The body cannot take it. That's why they have an effect. So before you taking a vaccine, you have to take care, responsible your own health. Take a lot of water first, and make sure your body condition is good and enough sleep. And try to avoid a lot of food. You have to eat very clean first. Then you inject, and also have to, after you inject already, your body will feel a bit sore pain or what, or muscle aching is normal. Then you have to take a lot of water and responsible to yourself. After the 2 weeks, the second dose, you inject, then your body will be synchronized with the vaccine. So don't worry, whatever, like the last 2 days, someone sent to me, now in Malaysia, you can register for the vaccine. So when I registered already, come up within 3 hours, about 2 million, 200,000 or 2 million, all gone already, all finished, all activate. And then my friend say, "Ayo, this not that one got cord blood, or this one. Until they decide whether they want to take this vaccine or not, but all the medicine gone. So sometimes it's called, now we are living in this situation, vaccine is very important. You cannot say you have to choose what kind of vaccine. Of course, you have to understand your body. Like me, my body condition is good, then I should be no problem. I can go all the what kind of vaccine I also have to take. But some people, they have a very weak in the body, like some of my staff, even they're taking the x-ray, they're putting the solution on the drink little bit of the solution to put inside the x-ray. Some people taking the solution of the x-ray, then after they take the MRI or CT scan, you can see all the what. The person also cannot take it because then that one have to be careful. The kind of people have to be careful. Other than that, should be okay. And vaccine is good. You have to immune yourself to a more stronger person. All right. And wow, now it's 2 o'clock. I have to go for the next appointment. And now I'm very sad. I see like India. So hope everyone have to be responsible to fight this number go down, COVID number go down. So stay at home more, work at home more, don't go out. Not the right time for you to celebrate or this one or birthday or meet up friends. It's not the right times. It's right time to, I can say, be a right time, be a selfish too, responsible yourself and responsible to your family members and your what. And now Mother's Day is coming. If a Mother's Day is coming, I can say don't celebrate too grand or what. Just a normal, just eating is one of the best solution. And now it's Malaysia, is Hari Raya is coming. And if you go to Bazaar or what, have to see not that many peoples. And whatever you done really, always wear mask, sterilize your hand. And then you are not transmit people or people will not transmit to you. So during this festival period, handle and responsible. Always carry with sterilizer and always using the mask. And mask not cover your mouth, your nose open up. So a lot of people wearing mask like this, not right. To cover, if possible, cover everything. And using everything touch backhand. Don't using your palm. After touch, you touch your eyes or nose. Especially money. And money also, now the money transmit very fast because the money you go for bazaar or everywhere. The money, you don't know whether the person got COVID-19 or they're using hand and take out the money and pass it to you. And you receive and pass it. Actually, the money, the more sturdier. They carry so many germs. So, don't know what to say. So no matter what, I'm Chris Leong. Responsible to yourself and responsible to your country. Bye bye.